Okay, I'm supposed to get some teacher skills and raise my arm. Okay, so we're going to go ahead and get started with the talk. Did everybody get food?
Delicious, thank you.
You're welcome. Who still needs to sign the sign-in sheet, just so I know where to take it? Okay, some people in the back. Okay, perfect. So make sure everybody gets to sign this. It got passed around, and then I'll kind of keep an eye out where people still need it. Okay, so I'm going to introduce, we're super excited. I know a lot of you have Cushing's horses or metabolic horses. It seems like we have a lot of those in our population. So we're super excited to have Boehringer Ingelheim. They sponsored the dinner, so thank you very much for that. And there's a few handouts and hoof picks and different things in the back if anybody wants to grab one of those. And then they brought us a couple, we're going to have lots of names to draw tonight because we brought a couple Hunt Country prizes, and then they brought a couple prizes too. So we have some good drawings at the end. So Sally is our rep that comes and meets with me and Rachel and lets us know about new products. She's awesome, does stuff like this for us to support you guys, help us with our mission to educate our clients, and help you guys be empowered horse owners. And then Dr. Julie Settlage is here to talk to you about your metabolic concerns and about grass not being good enough.
Grass being a little scary. Yeah, thank you. And thank you all for coming tonight. Your time is valuable, and you humble me by showing up and sticking around after this awesome party to stick around and watch me hopefully educate you guys. And so the first thing of education, and this is not picking fun of anyone except myself, is no one knows how to pronounce our company. I've been with Boehringer Ingelheim for 3 years, and I just got told this week that I was pronouncing it wrong. So it's Boehringer Ingelheim. And if I was German, any Germans in here? No? So if I was German, there'd be a little bit of more of an R guttural, and I can't do it. Boehringer Ingelheim. Yeah, something like that. I can't do it. But literally, I was just informed on Monday that I've been saying it wrong. And I work for them. So anyway, that's what happens when you work for a German company. And so tonight I'm going to talk to you about your metabolic and PPID horses, and I apologize in advance. I don't know how much grass the try-on area has, but you're going to look at it suspiciously when you leave here today. And you're going to wonder if you'll ever let your endocrine horse eat it again. And I apologize, okay? And so how many of you, curious, how many of you have a PPID or Cushing's or equine metabolic syndrome horse? All right, keep your hands up, keep your hands up. How many of you additionally have a pony? All right, yeah, so, and then how many of you have a very fat, lives on air horse? Yeah. And so if you've raised your hand, I want you to raise your hand again and keep it up. That's when everyone look around. This is ubiquitous. And so ponies are really, like if I was to pick any horse or equid and say you probably have a horse with an endocrine disease, it would be a pony. I could be wrong, but my chances are better. If you're a betting person, you're going to pick a pony. And if you have a horse that lives on air, you're likely to have an endocrine horse. How many of you have horses that are over 15? Over 15. Yeah, so you're likely to have an endocrine horse. So playing the odds, it looks like the vast majority of you, unbeknownst to you potentially, might have an endocrine horse. And unfortunately, especially with PPID, once you have, well, even with equine metabolic syndrome, once you know you have endocrine horse, I call them all special needs horses. That their special care never goes away. You can't say, well, I'm going to do all this work and I'm not going to have to worry about it after a year, whatever. It's once an endocrine horse, always an endocrine horse. You might reduce their risk factors, and we'll talk about that. but you'll never be able to say to them, I can't let up my guard. And so when we talk about this nutrition stuff, when you have an endocrine horse, unfortunately, this is the stuff you have to think about the rest of the time you own that horse. So which I hope is for, if you're the type that likes to have horses for a really, really, really long time, I hope you have them for a really, really, really long time. All right, so a little bit about me. I'm a Virginia native. Driving through this part of the country today, it felt like I was home, and it's the same mountainous type of, and it just, y'all still have color in your leaves. Our trees are gone by this point in time. I identify as a runner. How many of your horses identify as an athlete but aren't really? That's me. I identify as a runner. I had to have a career change, and so now I bike because I'm lame. And you'll see up there that I have a master's in veterinary education, because that's truly my love. I love being a veterinarian, but my most favorite thing is to teach. And so again, that's why I'm just honored that y'all are here. But I don't like just hearing me talk. And so I'm going to challenge you guys. I'm going to potentially give you things that you have questions about or you don't like. I'm fine with that. You can tell me about that too. And if you have any, just interrupt me, raise your hand, speak up, answer my questions, please. I'd love to, if we need to go on a tangent to help you guys out, I'm happy to go on that tangent. So staying up here and just chatting away, I can hear myself talk in the car, so I'd love to hear your questions.
Prizes are for answering questions.
Yeah, so we have some really fun door prizes up here. I'm not going to speak for Hunt Country's door prizes, but our door prizes, the more actively participating you are, the more likely you'll get a door prize. So today we're going to do a brief overview of the endocrine disorders, because I'm more interested in certainly helping you identify your horses that might be, and then helping your veterinarian diagnose those horses as endocrine. But I want to spend a little bit more time on what y'all can control, and that's the horse's diet. That is my 30-year-old gray paint that my sister stole from me. That is, for me, a unique specimen. So she's gray, and she's 30. I have her papers, registration papers. No melanomas, not one, and no endocrine disease. And so I hit the jackpot on her, and I don't know how. She'll turn 31 in April, so far so good. But yeah, that's my youngest riding her. All right, so what is the endocrine system? Y'all have heard of the endocrine system. So we've talked about, do y'all know the part of the endocrine system that is affected by, I'm going to change, how many of you like to use the word Cushing's? All right, it's not Cushing's. Cushing's has a real definition, and when we found out more about horses don't have Cushing's disease. They have PPID. I'm going to tell you what that stands for in a minute, and you can then immediately forget it. And so we're trying to change everyone to be using PPID. So when you talk to your human doctor or you talk to your small animal veterinarian, when you use the word Cushing's, you will confuse them, because that's not what your horse has. Your horse has PPID. And so does anyone know what endocrine organ is affected by PPID? Pituitary, right. And what about the equine metabolic syndrome? Any idea? So you would think pancreas was what was offered. You would think it was the pancreas, but what it isn't is it's actually all of our cells that use glucose, which every single one of our cells stops responding to the insulin. That it's very similar to, I don't know if any of you guys have insulin resistance. Anyone want to volunteer that you have insulin resistance? Yeah. And so it's very, very similar to that, the equine metabolic syndrome is. And so the endocrine system is a really diverse set of organs and cellular responses throughout our body that 100% keeps us healthy. They produce chemicals and hormones that stay locally, go across the entire body, and influence our state of health and homeostasis. And so if we get messed up in that area, it can have profound effects other places. And so when we look at the symptoms of PPID, you'll see that it's not, we think pituitary, we think growth, but it's actually systematic. It affects a lot of different systems in the body. Horses have, the main endocrine diseases in horses are equine metabolic syndrome, and they are the PPID, which is pituitary, that's the organ, and it has parts, and then we get fancy with words because medical terminology likes to be fancy. Pars intermedia, which is the part of the pituitary that's affected, dysfunction, PPID. And if you want even more details on PPID, we have a website called idppid.com. And it goes into lots of depth on anything and everything you might want to know about PPID. And then unfortunately, there's some horses that have both. And that, any of you guys have that? A horse that has both? Yeah, and so I hope, and never wish that on you. So then you have to manage both of them. So what is PPID? It is the most common cause of, or endocrine disorder in the horse. Typically we think of it as in older horses. When I was in vet school, which was a long time ago, it was over 25 years ago when I was learning about this disease. We learned that the vast majority of horses that lived into their 20s probably had Cushing's. That's what we called it back then. It was a disease of older animals. And in fact, when we look, I'll show you a picture of an older animal back then. Some of you might even recognize that as an old horse that we don't see very commonly anymore because we can identify this early and treat it and prevent old horses, well, I'll show you what I mean by that, from happening. But we found that we're diagnosing it now because we're getting more and more education about it earlier and earlier and earlier. And what's cool about that is that we can prevent old horses from happening. Again, I'll show you what that looks like. The horses will still age, but they won't look like what old horses used to look like. We also know that if we can catch them early, we might prevent some musculoskeletal issues in horses. How many of your horses have a poor top line? Yeah, so some of that is genetics. They're just you're gonna have to work hard to get them a top line. Some of them are we don't exercise our horses enough and make them carry themselves well enough to get a good top line. And some of that might be PPID because it affects the musculoskeletal system. And we will see it often on their poor top line. And so the pituitary is in the brain. That's, so this tiny little, the pointer doesn't work on the TV. The tiny little pituitary, it's right next to the brainstem in that circle. It starts as wrong secretion of hormone in there that then affects other parts of the endocrine system going down the endocrine tree, and we end up with our clinical signs. All right, so early clinical signs. So this is a 22-year-old. I'm sorry for the people in the back. I don't know if you can see, it kind of looks like a poor hair coat here. This is in the spring. They should have been fully shed out, and that they're just not shedding out very well. A little bit patchy, a little bit uneven. There's some longer hairs that are sticking around. And then even earlier, that's when the whole body starts to retain a little bit extra long hair. Those of you that have PPID horses, did that happen to your horse? They didn't want to shed out in the spring? And so I would suggest think about your horses 1, 2, maybe even 3 years prior. Did you ever notice just longer hair on the forelimbs? This is a picture of the back of the cannon bone. You can see a little bit of longer hair there, but oftentimes on their forearms, you're right next to where you're girthing them up on that forearm. On the back of that forearm, they'll keep some longer hairs in that space. Don't wait for the whole body not to be shedding out. If they have just that little regional not shedding out, that could be one of the earliest signs that you'll know or you'll see. That mild muscle loss, if they've had a great top line and now all of a sudden it's getting harder or impossible to manage, to get them a good top line, they should be looked at. How many of you guys have had a horse with a high suspensory? Okay, I was gonna say how lucky. I've never been anywhere that didn't have eyes. So obviously animals can get injured. But the research has shown that horses that have high suspensory injuries also are more, compared to an age-matched, controlled, non-injured horses, way more likely to have PPID. Again, because that hormone tree affects all of the tissues in our body. So the hair coat, the immune system. Any of you guys ever have a horse that just feels like they're always getting a hoof abscess, or they're always getting a skin something, scratches, or they're always getting an eye ulcer, or they have a wound that's taken forever to heal, or all of those? That could be another early symptom of PPID, because that part of the endocrine system affects every system in our body. So anything like that, it's easy. Do y'all know how to diagnose PPID? Blood test. Yeah, how easy is that, right? We pull blood and we send it to the lab. And then if we want to, in the spring, we can actually take that same blood test, but then give them a hormone and wait 10 minutes and take another blood test. And that is a little bit more sensitive. So if the baseline blood test doesn't give us a positive result, but we're still really suspicious of it, that hormone in a 10-minute test might tease out a very, very early case, so that we can really refine down into that. So other clinical signs that we can have is, so this is that same horse looking further back. You can see how he just has that patchy long hair. Again, this is relatively early. Change in attitude. How many of you have horses? I know we do this with dogs, I'll get you in a minute, that when they get old and they just want to hang out in their bed, we're like, oh, he's just old, right? Horses, how many of you have horses that are 25, 26, 27 and still want to go on a trail ride? Yeah, that really enjoy it. Yeah, so that lethargy that you might be, now some of them have lamenesses and stuff that we can't use them the way we want to, but lethargy or just a change in behavior towards a more dull animal, otherwise everything being normal, might be another clinical sign of PPID. Yeah.
She was just a bitch.
So this isn't the only thing. So is this a PPID horse that turned into? No kidding. So usually oftentimes we will diagnose horses with PPID that are school horses. We put them on Presend and get their symptoms under control, and then we get a call from the veterinarian. The horse turned into a little bit of a nightmare for the schooling barn, and none of the 6, 7, and 8-year-olds can ride it anymore. And it's because it feels normal again. It's no longer dull. And I've actually had some riding barns take them off their Presend so they can use their horses again. I'm like, no! So yeah, so it can make it, that's an unusual. Yeah, so usually they don't get, but if it doesn't mean it's not. Again, it can show up a little bit anyway, but these are the main clinical signs. So, all right, so this is that old horse that I grew up with. Yeah, so we don't see them anymore. But this used to be the stereotypical old horse. 30 years ago, this was the stereotypical long hair coat. Long hair coat, all year round, long hair coat. Usually skin diseases. You can see this one has some, probably some, well, I don't know what he might have, but something going on with his skin. Found, lots of foot abscesses, dental disease, and skinny. You can see not able to keep any muscle on him. This doesn't happen anymore.
What year? What year was that?
So I don't know.
What are you talking about?
So when I was I was late 90s when I was a student, before Presend came out. When did Presend come out? I don't remember. It's before
Early 2000s.
Probably, yeah. No, I don't even think that long. Probably 15 years ago? Maybe look it up. How about that? No. I guess kind of mid 2000s. Yeah, but so this was a late 90s horse. And we did not have an effective way. We tried to treat. We recognized that there was an issue. And we usually knew, we didn't have a really good test at that point in time either. But we knew what was going on. And we knew what this syndrome was. But we didn't have a good way of treating it. We used compounded drug that wasn't good. But this is what a lot of old horses looked like. And we don't see that anymore because we have an effective way of diagnosing and treating now. And so, yeah. All right. Any questions on early clinical signs or late clinical signs on PPID? Because now we're going to go, yeah.
Are certain breeds more predisposed to it?
Ponies. Yeah, I actually sat through, actually, no, sorry. Ponies is equine metabolic syndrome. PPID is an equal opportunist. Yeah. So age is the predominant risk factor for clinical signs. We used to think late teenager and onward, but we're starting to diagnose more and more horses, even less than 10. So I was in a clinic just a couple of weeks ago that had diagnosed their youngest at 6. Yeah, I know. It's horrible, right? And again, you're gonna ask me why, and the question is, when would that horse have been noticed 10 years ago? You know, as we learn more and more and more about these horses, we're diagnosing them earlier and earlier and earlier. Yeah.
So I have an 8-year-old.
An 8-year-old.
Yeah, so is there anything preventative?
No, unfortunately. Nothing to prevent.
2 horses, one that passed at 30, he never tested positive, but PPID might have been his problem. And one that passed at 27, and he's fine.
Yeah, good.
And I have a friend of mine whose horse is going to be 34 in April, and she rides
And she's fine.
constantly, and he tests negative.
Yeah. So age does not equal PPID. It's just the older a horse gets, their likelihood of being diagnosed with PPID increases.
You can do preventatively.
No, not for PPID. Nothing you can do preventative for PPID. It is something that will happen. What's nice, though,
Is this a hereditary?
we don't know. We don't know that. And I doubt it because it's equal opportunity. I just think that horses are living longer now because we're taking such good care of them, and so it's just something they have.
So your recommendation is to have a PPID test every year?
Only if they have clinical signs. Just any blood test, doesn't matter you or our horses or our dogs or our cats. If we don't have a really good clinical reason to do that blood test. So blood tests, when you get results from a blood test, it needs to be, it doesn't matter what it is, a CBC or a PPID test or an equine metabolic syndrome test. If the animal, including us, has 0 symptoms, you can't use that blood test to diagnose. It might make you suspicious, but you need to wait until there's clinical signs, because you might have no clinical signs ever. And so why are you going to treat? If it's never going to become a clinical entity, it's never going to bother the horse, you don't need to treat. Versus if you can find an early clinical sign and then have a positive test and then start treating, then we'll probably not allow the disease to progress. So you won't get that. Yeah.
What are the side effects from the treatment?
That's a good question. Anyone have a horse on Presend? What are some side effects you've seen?
Mine's lethargy.
So, okay, is that the whole time or just when you're starting?
When I started.
Yeah, so there's a lot of clinical problems, not a lot. Most of the problems we have with Presend happen within that first starting of treatment, that first week to 2 weeks of starting treatment, but then they typically come out of that. What else? So lethargy can happen, and appetence can happen for sure. Any others? Thirst. So maybe. That's not a common one. Yeah, I can't say no. Sometimes we'll hear, every now and again, I'll hear of a horse that changes like the color. They'll get lighter or change a little bit in color. That's really uncommon. What are other ones you've heard of, Sally?
Side effects?
Side effects.
Coming off feet is the biggest one.
Yeah. Yeah, coming off feed is the biggest one, and that's usually associated with starting treatment, and there's ways to counteract that.
But it doesn't affect any organs or anything?
No, it actually improves because you're getting the disease process under control and not allowing the cascade of the endocrine problems to affect the other organs. So they have the ideal treatment is for the rest of their lives, every day for the rest of their lives. Yeah.
So endocrine system is also thyroid. How is it related to thyroid?
Yeah, that's a great question. And so the American College, the Equine Endocrine Group, which is a group of highly specialized equine internists, just published a book. It's a booklet for veterinarians on thyroid disease. Veterinarians that are in the back, you can pick up a copy of it at AAP this year, or Sally can bring you one. They actually, confirming what I learned in school, primary thyroid disease is exceptionally rare in horses. And so now you're going to ask, why am I putting the metabolic horses on Thyro-L, right? And so I'll talk about that in a minute. And so primary thyroid disease, either high or low, is exceptionally rare. Blood tests might show you, typically if they're going to show you an abnormality in equine thyroid disease, it's going to be low. And oftentimes for ease of communication now firmly by the American College of Veterinary Internal Medicine, veterinarians will call that true hypothyroidism, but it's not. It's usually secondary to something else. So there's something else going on that's influencing the thyroid to decrease its production. And so that's what you need to aim for. It's not a primary thyroid disease. But we are not using Thyro-L in metabolic syndrome to do anything with the thyroid. We're just taking advantage of side effects. Okay, so of the Thyro-L, yeah.
Did you say that a horse could test positive for PPID
And not have it.
and not have it?
That's why we only suggest testing in the face of clinical signs.
So what's up with that? If they test positive, then don't they have it?
So every blood test has a confident. So now you're getting into statistics, and that's where I can tell you the cheap version of statistics, but I'm not a statistician. Every normal range has a confidence interval. Are there any statisticians in the room that want to explain this better than me? And so when so that's why there's a range.
A false positive?
100%, yeah. And so that's why we don't recommend testing unless there are clinical signs to support the diagnosis. Yeah.
What about a seasonal rise?
Yeah, so that's great question. In the fall, there is in all horses, including those that live in the Caribbean, where we would think there isn't a fall, but we did the study and looked. Even Caribbean horses in the fall have a natural rise in ACTH, which is the hormone that we measure for PPID diagnosis. And the Equine Endocrinology Group has revised every 2 years they come out with new recommendations. Their last recommendations were in 2022, so we'll have an update of that in 2024. And in 2022, they actually, instead of giving us veterinarians one simple range of abnormality, below this is normal and above this is abnormal, we now have seasonal ranges. So there's a spring range, there is a fall rise range, and then what I call shoulder season. But we don't do the hormone test, so we just do baseline testing in the fall. We don't add the hormone to do in deeper testing in the fall because horses react amazingly to that, and we don't know how high is normal yet. We will figure it out yet. And the more we can figure it out, the better we are, right? We'll catch these horses early. Yep.
What does Prayson actually do?
Now we're going to get there. Yeah, so I'm not going to get too much into the exactly what PPID is, but there's a part of the pituitary that starts making too much of not ACTH, but too much of a hormone that then influences another part of the pituitary that influences the adrenals, and it's just this big cascade. And so the percent suppresses that original. Starts at the top. Yeah, starts at the top. Yep. So, yeah. All right. Equine metabolic syndrome. How many of you guys have a little fat thing like that? A couple of you? Yeah. And so that doesn't mean anything. Just letting you know. It just means he's fat. But there's other parts, right? So the crusty neck. And so these guys are typically, compared to the PPID horse, are typically younger. We're identifying PPID younger and younger and younger. And we can have, so typically we're identifying these guys less than 15 years of age. It's not to say you're not going to suddenly diagnose a 22-year-old and somehow or another they've avoided diagnosis before 22, but usually these guys we're identifying earlier. So the major components are obesity, but more this regional adiposity. So the crusty neck, the fat pads over their tail heads, the fat pads behind their shoulder blades. And then chemically in the blood, high insulin. That is probably the mainstay. You can have a very obese horse that has perfectly normal insulin, and they're just fat. They're not metabolic, yeah.
Is there a big difference between a pony and a mini horse?
As far as, so the miniature people would definitely tell you there's a huge difference, right? They're going to tell you they're horses and not ponies.
Symptoms, why?
No, so insulin resistant metabolic horses typically have, well, not always, but I'm going to show you a Venn diagram in a minute. It's going to make it all clear and not clear at all. So, yeah, unfortunately. Ultimately what the Venn diagram is going to show you is that looking at a horse, it's really hard to 100% diagnose from looking at a horse. That you need to deep dive and do the blood testing to see. Yeah.
So equine EMS is kind of the opposite of human diabetes.
So juvenile diabetes, yes, but more like adult onset diabetes. It's insulin resistance, metabolic disease. I don't know what the current terminology is in humans. Does anyone know?
Type 2.
Type 2, is it type 2 diabetes? That's what I'm not, yeah, so it's more similar to that, insulin resistance. Yep.
Are they going to come out with one of those little patches that people wear so they can keep track of?
So they're using something in kitty cats. I was looking around for a small animal veterinarian. There isn't one in here. But they are using something like that in diabetic cats now. So whether or not that will, so the problem is that baseline insulin just gives you, which is what you test, we want them fasted. And so wearing one of those is going to give you a false insulin because they're not, most of the time horses have had something to eat. So we're supposed to do that test when they've been fasted. So, yeah. And then the insulin, that high insulin, PPID puts you at risk for laminitis. Equine metabolic syndrome significantly puts you at risk, your horse is at risk for laminitis. And it's the high insulin. The people that study, the veterinarians that study laminitis, there's a big group in Australia. His number one model he's studying laminitis. He wants to know all of the different chemical processes that are happening during laminitis so that when he can help all of us know effective treatments for laminitis, because you all know that we're better than we were 20 years ago, but we're still not very good at it. And so he wants to put tools in our hands to get better at treating laminitis. And his number one way of inducing laminitis in his research horses is by giving them infusions of insulin. Right. So that high insulin is what is hard on your horses, potentially hard on your horse's lamina, horse's feet. They don't have the delayed shedding or the long hair. They can be fat and with long hair and maybe have both or neither. So you need to do your testing. All right. So why is insulin so important? Insulin, so we need sugar. Every single cell in our body needs sugar to survive. And so when we eat food, and it's sometimes it's sugar, sometimes it's protein, sometimes it's fat, but our body does not, our cells don't use the protein or the fat. That all of those go through processes to turn into sugar, and that's what our cells use. And insulin tells our cells to uptake that sugar so that they can be fed. And so if we don't, so juvenile diabetes, that's the pancreas. Who said pancreas? Yeah, that's the pancreas just not making enough insulin. And so their cells die. Because they aren't getting the signal to say, eat the sugar that's in the bloodstream, take that up. And so when you do a blood test on a juvenile diabetes, they have very low insulin and very high sugar. And our metabolic horses, they make plenty of insulin, but the cells can't hear. And so what do we do if you can't hear? You yell. And so the pancreas throws out even more insulin and says, cells, take up this sugar. And the cells say, kind of hear ya. And so they throw out even more insulin. And so that's why the insulin gets really high. And eventually they get high enough that the cells start taking in the insulin, taking in the sugar. So when we measure horses, fortunately, horses don't get low blood sugar. Thank goodness. That would be a horribleness. But they do get the high insulin. And so typically we measure, when you send in a metabolic panel to the diagnostic companies, it's usually ACTH, which is testing for PPID, insulin, which is testing for EMS, and we always throw in the glucose, and I have yet to have a case that the glucose teaches me anything. It's usually normal. But the other two teach me something. There's also an additional test for horses that are kind of insulin resistant and their insulin is normal on baseline. We can do an oral sugar test for them. We can give them a load of sugar. Here's the candy bar, eat it. How many of you have had babies, women? You've had an oral sugar test probably. And so that's what they were looking for to see if you became insulin resistant during pregnancy. And so it's the same idea. We give them oral sugar and then test their insulin over the next hour or so and see if they have low-grade insulin resistance. So the reason fat horses tend to be the ones that are insulin resistant or metabolic is because adipose tissue, we used to just think it was a storage mechanism for us, and it is, but it's metabolically active, and so it has a lot of influence on the body's endocrine system, and so that's why the more fat a horse is carrying, the more likely it is to have metabolic syndrome. All right, so this is that Venn diagram I was going to show you and make it all clear as mud. And so you can see green are horses that have just PPID. Then we have purple, which is just fat horses. But then we can have that overlap and we have just fat PPID horses instead of a lower, it's hard to see their muscle mass. They're just fat PPID horses. But then we can have horses that are in the orange and they are equine metabolic syndrome, but they can be skinny, lean equine metabolic syndrome, high laminitis risk. Typical equine metabolic syndrome is where the obese and the lean overlap, and that's our typical horse, our classic horse. So no, it's where they're not. That's just where they're metabolic syndrome, but not lean. They're fat. That's our typical one. But then we can have lean equine metabolic syndrome horses that are also PPID. So that's a combination. And then we can have all three. We can have fat, EMS, PPID horses. So the kicker here is you looking at a horse for metabolic syndrome. If they're skinny, they still could be metabolic. And so when to test, right? When to test, it's typically the fat horses, that's easier. Your vet's going to be pushing to test potentially. Let's throw an insulin in. Ponies, they might be pushing a little bit more. Let's throw an insulin in and see. Let's test. But the lean horses are the ones that get missed. And I don't have a secret sauce for you guys. I wish I did. Typically, they're diagnosed with their first bout of laminitis. And it's like, oh, shoot. It didn't even occur to me. And it wouldn't have occurred to you to test them. And so, yeah.
Do you use metformin for the
That's on the list of available drugs for these horses. Unfortunately, metformin has a variable absorption rate in horses, and so some horses might absorb it great, and so therefore it might have an effect. And other horses, they don't absorb it at all, and so it can be a very frustrating drug. But we'll talk a little bit. I'm not going too much into the in-depth as far as drugs for that one, because the number one effective way of handling equine metabolic syndrome is through diet, getting their lean muscle mass up, getting their fat tissues down, and controlling their diet. And that's what the rest of this is going to be about. That is the most effective. There are some brand new drugs that are out. Actually, they're human drugs that are out that are showing to be more and more promising for, and they're the SGLT2 inhibitors. I'm trying to come up with the human names of them, and I don't know. I know the long name, but I don't know what the human drug names are. They're relatively expensive, but they seem to be very, very effective. And what they do, the SGLT2 receptors in the kidney, and every animal was evolved to not let us pee out sugar, because sugar is really important to our metabolism. And so our urine has 0 sugar in it, unless you're diabetic. They don't have a lot of sugar in it. And so the SGLT2 receptor pulls the sugar from the first urine as it's going through the kidney back into the bloodstream. The drug, the SGLT2 inhibitor, stops the kidney from reabsorbing the sugar and lets the sugar get peed out into the urine. And so it pulls the sugar down, which if you pull the sugar down, you're going to pull the insulin down. And so that has very early promise of helping some of these metabolic horses. It's just I don't think we've done, it's so early in the literature and research. I don't think they've looked at any of those muscle disorder horses and what it might do to them. It's just that we're in baby steps here. Most veterinarians haven't touched those drugs because we just don't know enough about them. We don't know, sounds awesome, but I can also tell you those drugs shoot the triglycerides through the roof, and we don't know what that does to horses. And so are you borrowing trouble to treat trouble? Yeah, I don't know. And so some people are using them in really bad cases and having good results, but we just don't know enough yet to make it standard care. And they're human drugs, and so they're really expensive. Yeah. So, yeah. All right. So, Presend is the treatment for horses. It attacks those hormones at the very top, makes the pituitary stop creating the trouble it's creating. And so we start at the very top with that. And then nutritional management, which we're going to get through. And again, that equine metabolic syndrome, decreasing that fat tissue. It's metabolically active. We need to get rid of it. And so if you have one of these horses, if you have a fat horse in general, increasing the exercise, increasing the lean muscle mass, and controlling the diet to get that fat under control. All right, geriatric horse. So remember, a lot of these horses. So again, I'm focused in on the endocrine stuff. PPID horses are going to have trouble other places. They also tend to be older. They're going to have trouble in other places. And our metabolic syndrome horses, we've got to make sure the rest of our body is okay, so that we can, again, I guess I'm pushing whole horse management. Don't just focus in on this one problem and forget about the rest of the horse. So if they're greater than 20 years old, What are we worried about? Dental issues such as cheek teeth and their incisors, their GI function, their muscle mass deteriorates, so they can't do their work, their body condition score deteriorates. So, it makes it hard with these horses. And so the reason I'm throwing this in there is because everything I'm about to tell you works for these guys too, especially if they are a metabolic horse as well. My goal is to have every single one of you with horses that are special needs to live past 30. Wouldn't that be awesome? In a useful way. And useful could be just hanging out with them. What's your favorite time of being with your horse? Is it riding it? Mine is right after I feed. And I hear the chewing in the barn, and it's peaceful. No one's around. It's just me and my horses. That's my favorite. And if I could do that every morning until I get joy. Some of you are like, no, I have to ride them. How many of you are that way? You have to ride your horses? Yeah, it's okay. It's okay. Yeah, and so think about the whole horse management. All right, so how do we manage this stuff? So can you look at these horses and decide what they are? So yeah, the one in the middle is laminitis. And so if you had to guess PPID or EMS, which one's more likely to cause laminitis? EMS, exactly. So can we tell from the picture if he is PPID or EMS? No. Now, acute laminitis like that, we can't test anymore. Because the stress of that pain, we eventually will be able to test. But the acute stress of that pain throws everything off, and we can't trust any of it as a diagnostic. It'll just show us that they're really stressed. And yep, I know, they're really stressed. And so we have to get that pain under control before we can actually do our diagnostics to see exactly what might have contributed to that. What about the really fat guy on the right? Do we know? Likely, but maybe not. EMS. What about the guy on the top? Skinny, no top line, more maybe PPID. Could be a really skinny EMS horse, but more than likely a PPID horse. What about this hairy thing at the bottom? It could be all of it, but it's PPID if you had to pick one. But they stack. These symptoms stack. Every horse isn't the same, and every horse's nutritional requirements are different. Let's just say every single one of these horses has PPID. Let's just say it. Are we going to feed them the same? No. I mean, we're going to calorie restrict the guy at the bottom, and we're going to really put the calories to the guy at the top, but we got to do it in a safe way. And because he has almost no muscle on him too, I'm going to pour the protein into him. And if I gave the guy at the bottom the same diet, right, yeah. And so you can see why I'm going to give you these recommendations, but every horse is an individual. And so we have to drill down on the horse's exact needs, their exact condition, and what their caloric needs are. You might be couch potato horses versus high, athletic demand horses are going to need different diets. All right, so I tried to give you rules. Rules are fun. So lower the starch and sugar. How many of you guys went straight to the dessert? Thanks. Yeah, I appreciate it. Yeah. Now, so horses, you put us in the stall. You hang a hay net, and you give them a bucket of feed. Where do they go first? Right. That's the dessert bar. All right. Now, some of your hay might be a dessert bar too. How many of you guys test your hay? So how many of you guys know if your hay is a dessert bar? Yeah, is it a dessert bar, or do you find other hay?
Orchard, low.
Low. You've tested it, you know, because all orchard grass isn't. Some orchard grasses. Awesome. Y'all my heroes. Yeah. How many of you have never heard of testing hay? Okay, thank you for being honest. Yeah. And so that's the kicker, and we're going to talk about that. So we want to avoid starch and sugar. It's easy with the grain bag because there's a tag on it and it says how much is in there. Hay, not so much. And so you can either buy tested hay, or you can test it yourself, or you can give you some tips and tricks about that. There's no proven % starch threshold. Now, I'm going to give you some advice, though, when I go through some of these slides on what we should be aiming for horses that we know are metabolic. All horses, so I know me, that if I ate the dessert bar all the time, I would look like that palomino on that previous slide. And so that's a lot of, so if we could get in the habit of testing our hay and feeding, not necessarily as strict as I'm going to tell you, but feeding more appropriate, if we can keep our horses leaner, horses that are tending to become a metabolic horse, if we knew what we were feeding them, we might not ever get a clinical equine metabolic syndrome horse, which is, no one wants a clinical equine metabolic syndrome horse because that means laminitis. No one wants that. All right, so industry, we go with less than 12%. That's hard. If you have a really bad, any of you have a laminitic equine metabolic syndrome horse that's had laminitis in the past? And so if we can get their starch sugar levels less than 10%, it's even better, because their feet that they've already traumatized with a bout of laminitis are easier to traumatize again. It's just their threshold for further injury is lower. So. All right, things to avoid, uncontrolled starch and sugary feeds. So look for guaranteed starch and sugar levels. How many of you guys have lovely, cool season grass pastures? Does anyone know what a cool season? Yeah, so yeah, fescue, bluegrass, timothy, orchard grass. Yeah. So those, if horses that are metabolic or PPID, endocrine special need horses should always have controlled access to pasture, or you're putting them at risk for laminitis. And then the last thing up there is if you must, we'll go through the pasture in a minute. If you must feed pastures in the cool season grass pastures, morning is best, and I'll show you why in a minute. Show you why. All right. It's the same for the geriatric horse. All right. Is grain bad? Yes or no? Depends. I love it. It actually does depend. It depends on how much you feed. Right? And I'll show you an example. But so no, grain's not bad. But what we're worried about in the bagels, I try not to eat those anymore, but my body loves them. My mind just goes, oh my gosh, it looks like great breakfast. So the non-structural carbohydrates, they become sugar in our bloodstream really, really fast, and that drives our insulin up really, really high. So they're easily absorbed. It's the glycemic index we hear about for us. The high glycemic index foods in humans are bagels, donuts, rice. I don't even know. There's all the things I'm not supposed to eat. So then it raises the insulin. So we got to try and get that down low. And so I'm going to take you through an example of why concentrates, grains, aren't as big of a deal. They're the easiest for you and me to affect, because I can look at a label and I can choose something different. It's really easy to change, but in the grand scheme of things, what's more important is your hay and your grass. And I'm going to show you an example here. All right, so example 1, I am picking a lower carbohydrate feed and an average grass hay. So my horse is about 1,100 pounds. And what we're supposed to feed in general is about 2% of the horse's body weight every day to meet their caloric needs. And so that means I'm going to be feeding around 22 pounds of food a day to that horse. So if I have hay that is an average grass hay, it's 20% non-structural carbs, and I'm feeding 16 pounds of that a day, then there's 3.2 pounds of carbs in that. And then I add to that grain, that's only 10%, so it's low of carbs, and I'm doing 6 pounds a day. I'm only adding 0.6 pounds of carbs to the total rate ration. So total of 3.8 pounds carbs. And if I find the percentage there, 3.8 divided by 22, that's the amount of food we're feeding, times 100 to get the percent, 17.2%. So for my metabolic horse, good or bad? Bad. Bad. All right. So now, example 2. I'm going to not care about my food, the grain. I'm going to feed a high carbohydrate food, but I'm going to analyze and pick the right hay. Same horse. So now I have a low carbohydrate hay, 10%, 16 pounds a day, 1.6 pounds of carbs. But you know what? I love my horse. He loves his grain. I'm going to give him dessert a couple times a day. Get a 20% carbohydrate grain, 6 pounds a day, 1.2 pounds of carbs. Total carbs, 2.8. I'm down to 12.7. And so I'm spoiling him with the grain, and I'm stingying him with the grass hay. And I have made the diet so close to that minimum recommended or maximum recommended sugars for a metabolic horse of 12%. And so obviously I can make that very easy better by decreasing the sugar in the grain. So you can see why hay, I can impact their diet way more effectively by analyzing their hay. Yeah.
Is there a correlation between the metabolic horses and like ulcers?
Yeah, it's a good question. Metabolic horses and ulcers. No. No, thank goodness, right? But can
Grain can help contribute to ulcers. So this is like feed more grain and less hay. And
no, you're still feeding only 6 pounds of grain. Yeah, it's not right. Still, yeah. So you're still feeding 60, just more sugar, proportionate sugar in my grain on this example. But still forage-based diet. No, and so my original talk, not for you guys tonight, but when I was developing this talk, I actually had ulcers in here too, because a lot of these recommendations for horses with ulcers, we do want to decrease the carbohydrates in them too. So we talk about grain, but ideally we'd also be getting maybe not as low as an endocrine horse, but if we can get their carbohydrates, because the carbohydrates that promote acid in the stomach. So, yeah.
Any chance we can get a copy of yours?
I can probably send a PDF to somebody to share with you guys. They're recording my talk. I don't know. What are y'all going to do with my talk?
Question for the vets.
Yeah, we'll find out. Maybe it's going to be on there. I don't know what's going to happen to it. So maybe it'll be available. All right. So, all right. Geriatrics and hay. If they can still eat it. High quality and soft, right? How many of you guys have toothless horses? Yeah. My 30-year-old still has teeth, but every time she's at my sister's, and every time I go see her, I do an oral exam because I'm curious how many are left. And then for these guys too, if they can't eat it, the senior complete feeds are the best. Digestibility, if you're ever curious about what types of grain are the most digestible, the pelleted grains versus the textured grains are way more digestible. Yeah.
I'm going to ask this question really clearly. So we've had a drought.
Say that again?
We've had a drought. We don't have grass. Some of us. And it's really short. It's really the worst part of the grass is the short part of the grass. So how do you even measure?
So pastures.
Out of the pasture, and I don't even have pasture. So.
Yeah, and so pastures.
A little grass here,
That's what I'm going to tell you now. It's going to scare. I told you at the beginning. It's going to make you scared of your pastures, right? Because we spend so much time and effort, and then we love looking at them. And now I'm going to tell you that they're dangerous. Yeah.
even if they're drought, like dry.
I'll show you in a minute. Yeah, because they're still photosynthesizing. They're just not growing. And so they're still putting sugar in there.
Gotcha.
Yeah. If you don't have an endocrine horse, your pastures are great. Endocrine horses are the ones that can't handle pasture. Non-endocrine horses can handle pasture. So, right, yeah.
What if you have a dirt lot with oak
nuts, you know.
So do your horses eat the acorns? Do they really?
Yes.
Yeah, and so that's an individual thing. Some horses just get fat on them because they're really, really high in fat, but they're not that high in carb. So, yeah. But whether or not there's other issues along with that, I don't know. I used to be a goat farmer, and everyone told me that acorns would kill the goats, and I stopped feeding every fall because they got so fat on the acorns. And I never had a problem with my goats. So even though everyone else said I was going to have a problem. And so I don't judge acorns. Okay. Yeah. I don't judge acorns. All right, so be wary of pasture. So photosynthesis. Green things in the sun are creating sugar. Respiration, I don't know, do y'all remember botany, high school biology? Respiration is when they use the sugar to grow or whatever. So respiration slows down in the cold, so we're entering that right now at night. It gets cold. And then in the spring, it warms up in the day and cold at night. Respiration slows. And so when respiration slows, what happens? They don't use the sugar as fast. All right, and then when it freezes, it stops. Grasses don't just stop their respiration. Anything unused sugar gets stored as starch, and typically, y'all are right, it's in the lower parts of the plant, so the bottom 4 inches. And so I don't know how many of you manage your pastures. We kind of like that 8 to 12 inch, like when you bush hog. 8 inches is what we're kind of aiming for, and then let it grow, get it done. Because that way you're hoping they're not grazing the bottom 4, which is the 2 things. Lots of sugar in the bottom 4 and lots of worms in the bottom 4. And so overgrazed pastures, you increase the sugar risk and you increase the infectious worm consumption risk.
So if you just keep moving them around?
That's the best. Yeah, I mean, but how many of us have that kind of land, right? Do you know how, for worm purposes, do you know how long a pasture has to be ungrazed to get rid of the worms?
8 weeks.
At least 8 weeks, yeah. So the parasitologist at Virginia Tech suggested 90 days. And again, because she wants to account for all the worms and all the conditions, it's probably shorter than that, but she suggested 90 days. And that's hard. If you're lucky, you can do 90 days, but the vast majority of us fill our pastures. I have 6 acres, I'll get 6 horses, right? How many of us do that, right? There's room for one more. There goes that rotation. Yeah. So this means, since we have the photosynthesis during the day, all day long, our pastures get more and more sugar in them. So how many of you guys switch your horses to start grazing at night in the summertime? Oh. So you're putting them out there when they have accumulated the most sugar the grass is going to accumulate. Yeah. Yeah.
So you don't turn them out at night?
Turn them out in the morning because the sugar rises during the day and it gets used during the night. And so just turn them out in the morning. It's the safest. It's not safe. It's the safest. Everyone does it. No, it doesn't matter. It doesn't matter where you are in the summertime. Why do we put our horses out at night? It's cooler and there's less bugs. Yeah. But so for your endocrine horses, not all horses, your endocrine horses, that is not a good idea. Not a good idea. All right, pasture tips. How many of you have heard don't fertilize your pastures? Let it get gross and junky. It's less nutritious. They won't get fat on it. And so it doesn't grow. So that sugar accumulates, just drought. The sugar accumulates versus if we have water, and we fertilize, it's growing, and the growth, that green dilutes the sugar, and then we can control it with bush hogging. And so fertilize your pastures. I grew up wanting crappy pastures because I had fat horses, and now I was like, I was lucky. I didn't have an endocrine horse, but if you have an endocrine horse, that's not a good management practice.
How about lining?
So I would always, for fertilization purposes, I would always talk to your ag extension agent and do soil testing to figure out what your pastures need. Some of them might need lime. I know my pasture, I was converting very similar looking land to pasture, and it was high acidic. And so I was using lime to help get that back down. So yeah, so definitely do soil testing to figure that out. And so fertilizing the pastures so you can mow and brush hog to make sure that your pastures are staying at a nice healthy height, and you're just getting rid of the sugar. You're not letting it accumulate, which is great. So how many of you, so we think, okay, I want the farmer to cut the hay in the morning because then it's going to be the lowest sugar hay. But if it's, we know you cut hay in the morning, it's going to sit there all day, maybe even overnight before it is baled the next day. It still photosynthesizes. After it's been cut, it still photosynthesizes until it's gotten dehydrated. And so it'll respirate a little bit, but not as effectively. The photosynthesis still happens, respiration slows down. And so hay cut in the morning will still accumulate sugar over the course of the day. And so if it's really bright and beautiful, perfect haying conditions, it's probably adding sugar to the hay. Sorry. Sorry. I know, I told you I was going to be in bad news. And so now we're in drought. So here we are. It grows less, and so it just accumulates. So this time of year, right now, this year, your pastures are probably, for endocrine horses, can be a pretty scary place to be. Yeah. All right. So I'm going to show you, this is a case, a couple of cases of forage analysis. So some of you do test your hay. You can look at your grain bags to see what you're feeding as far as grain. But I'm going to show you some of the, just a couple of examples here. All right, let's see. What do I got? Sorry for the small print for people in the back. So this is a orchard grass hay, and this is not a statement on orchard grass hay. This is a statement on the orchard grass hay that was tested for this sample. And this was sent out to equianalytical.com to look at it. You can see total carb in this hay was 18.8%. So would we want to feed that? No. Now, you just bought 100 bales, and you just had this talk, and now you're testing your hay, and this is what you have. All right? Now, I'm not going to tell you to throw that away. We could mix it? Tell me more. Who said that? Soaking it. Yeah, these are the non-structural carbohydrates that we're worried about, the starches and the sugar. They are soluble in water. And so you can soak this a good couple hours before you feed. Now you say, but it's about to be winter. I hear you. I feel your pain. Take bales home to your garage. Soak them in your garage. I am, yeah. Although it freezes, and the horses won't eat it when it's frozen. But I'm going to tell you, you can, you know, the big muck buckets that you can get at Tractor Supply or wherever. Get 2 of them and take a hole saw or some drill and drill the bottom of one of them, lots of holes, and nest them, so that you lift the hay out of the water and let it drain back into that bucket, and then that's what you take to the barn with you.
And throw out your old water, right?
Yeah, don't let them drink that water. That is lemonade. It is like full tilt sugar tea right there. Don't feed the hay in its soaking water. Then they're just like, whew. You gave me tea, sweet sugar southern tea. Thank you so much. Yeah, thank you for pointing that out. Throw that water away, 100%. Throw it away, because that's candy for sure. That's where all the bad stuff went. And so I don't know. You could ask. You could run another sample of your soaked hay and see how low you get it. But you can get it pretty low. You can get it close to that 12. And so that don't throw away your hay. It's gorgeous, beautiful hay. It just happens to have too much sugar in it. Yeah.
I have a question. I have a horse with inflammatory airway, so I steam her hay or soak it.
Yep.
But I was reading not long ago that leaches the protein now if you're.
It can. So you need to make sure you're on a really good ration balancer when you're doing that. Yep, you want to make sure, and that's why. So just make sure that what you potentially are leaching out, not just the sugar, but some of the other nutrients, you're replacing in a ration balancer. Yep. So yeah, you're right. Nothing's easy. But low protein is less likely to kill a horse than laminitis. And so soaking for an equine metabolic syndrome horse is really important if you have hay like this.
For a different reason.
Yeah, but for what you're soaking for airway disease, you don't need to soak as long. You just need to get the dust taken care of. And so you could just soak for 15, 20, 30 minutes and not have as much leaching for that, because you're just trying to control the dust. Yeah. All right, now another one. This one is Timothy. And again, I'm not picking on Timothy or saying Timothy is awesome, but this one had a total carb of 11.5%. So what do we think about this one? Yeah, it's great. This is great. Like, I'd be jumping up and down if I found this hay. 100%. All right, here's a Timothy mix. What do you think of that one? Yeah, that one, if I had a really definitely diagnosed equine metabolic syndrome, PPID horse, and I'd bought 100 bales of this one, I'd probably try and find a buyer and then hope I can find some tested hay and replace it. Yeah, that's going to be a lot harder to get down. Yeah.
What line are you looking at?
So we summarized it up at the top. It says total carb, but what we're adding is the simple sugars, which is the star, and the starch. So, yeah. And the non-fiber carb, the three lines there.
What was that Timothy mixed with?
I don't know. And when you buy hay, right? Orchard grass mix, Timothy mix. There's a little bit of this, a little bit of that, weeds. I don't know. All right, so this is what looks as a whole diet analysis, okay? Because we're looking at hay and feed. Do you see that? Getting 10, I wish I could point. Let's see if this will work. Does this show up? Does that show up? No. So the top line on the left, it says average grass hay, and they're feeding 10.43 pounds. And then the same column lower down, low non-structural carbohydrate feed, they're feeding 6 pounds. So this is a total ration balance. So we've analyzed our hay, but then I'm also telling the nutritionist, I'm feeding this amount of grain. Can you look at the diet? And so that's what this is looking at. So the horse is getting 16.5 pounds of food a day. Total ration, they're getting the arrow and the circle, they're getting 16.6% carbs. And so this horse is a PPID, insulin dysregulated, skinny, with muscle loss. What do we think? Too high of sugar. Yeah, too high of sugar. And so if we have a low, but he's skinny, so what do we need? Protein because of the muscle loss, and we need calories, right? Somehow, non-sugar calories. So somehow, what is that going to look like? And so the next one is same horse. We've changed the hay, so he's feeding a little bit less hay. We added a pound of 24% fat to that. And we got a better hay. And now we got the non-structural carbs to 12.7%. And so added calories because we needed calories. This horse is skinny. If this was a fat horse, I probably wouldn't have done much with that. I wanted to make sure it's a balanced diet, but I wouldn't have cared so much about those calories for a fat horse. So it could be a good source of fat. Rice bran can be. Mm-hmm. Yep. Another one, so same horse. This is a different hay. We chose, instead of adding the fat supplement for calories, because we decided to get even more excited about that muscle loss, we decided to add alfalfa. Why did we decide to add alfalfa? Protein, absolutely. And so now we're feeding more alfalfa. See, we went up to almost just over 12.5 pounds, gave more of the fat supplement, 2 pounds of the fat supplement, and then used an alfalfa-based diet balancer. So again, this is a nutritionist, a veterinary nutritionist, that is deep diving to exactly what this, so this is even better yet. So we went bad to better to really good. And so now we have low non-structural carbohydrates at 12%. And I think we got our protein up pretty high as well. I can't remember where protein was on here. Total protein up to 20% in the ration versus previous one, total protein was 10.8. So yeah, so again, how we can easily tweak diets if we know what we're feeding. Yeah.
What would you recommend as far as how often to feed?
Yeah, and that's so. A question is how often should we feed? And so that's I don't ever have a answer. I ask, what's your schedule like? My favorite is lots of little meals. That's my favorite. But how many of you guys see your horses every couple hours? Right. So some of you, yeah. And so that the horse would prefer a little bit very frequently, but the vast majority of us do 2 meals. Some of us can do 3 meals, and then some of us have to do 1, and then throw the hay in there, right? So it just do what's best you can. Yep. Horses do better with a little bit frequently, for sure. All right, so the next one's a real case. This is actually a horse that belongs to one of Boehringer's employees. So this was a 19-year-old mare. She had a history of sole abscesses in the fall. And then later in the fall, subclinical laminitis. So now me as a veterinarian, when I get that history, I'm thinking, I wonder if those foot abscesses are actually laminitis that were misdiagnosed by the owner. And I'm not saying that's a poor owner, it's just that's making me wonder. Was there something going on with the lamina then? I'm not saying he didn't have hoof abscesses, but I'm wondering if the laminitis was going on longer than just in mid-November. So we did some testing, and the ACTH and the insulin are through the roof. Now, what's wrong with that? But I already told you what we shouldn't do. Well, so they're both really high, but I tested during a current bout of laminitis. And so I have to hold them with a grain of salt, but these are through the roof. Yeah. So more than likely, this is real. It might be higher than real, like higher than, but I don't think this is a false positive. I think this is a real positive.
You've got enough clinical observation to make that decision.
Right. Yep. Exactly. So immediately we pulled her off the pasture. The owner hadn't pulled her off her pasture, and we're like, the pasture's dangerous. So we're going to put her in a dry lot. And then we're going to do a diet analysis because I want to make sure we're in the midst of crisis. She's also fat. And we're in the midst of crisis, and I want to make sure that everything that goes in her mouth is helpful and not additionally hurtful. And so she'd been fed the same batch of hay all summer. Do not ask me why, but they were feeding a rabbit brand of like alfalfa hay that you would buy for rabbits. So don't cringe at it. I know you're gonna ask me why, but when we do the hay analysis, you're gonna actually see like, wow, this one's not so bad. So, but you know, you can go into, do y'all have Rural Kings around here? Rural Kings, you can go into Rural King and they have bales of hay, alfalfa labeled for rabbits in there. So it's expensive. I don't know why you would ever, it's more expensive than what y'all would be feeding for sure. And they started her on Presend to get her ACTH under control. And then retested, because it's a Boehringer, one of our team members' horses, and so we just kept testing. I probably wouldn't test in 2 weeks, but we're like, well, let's just see what happened. ACTH was still high, but down. And insulin, just by a simple pulling her off her pasture, was normal.
What should the ACTH be?
So that time of year, so you have to pull it out and look at my phone. I'll tell you later. I always have to look it up because they've changed it. So that time of year it can be higher than that. All right, and so this is what the feed that they were getting. So the alfalfa hay from Pilgrim she was getting fed 26 pounds a day. But almost no grain. There's only getting 2.5 pounds of buckeye. So it's getting 28 pounds of feed a day. But look at that non-structural carbs. Less than 10. Right, yeah. And so that's why just pulling her off the pasture was the only thing. Yeah, she's still getting probably a heck of calories that she doesn't need. And we need to get on top of that. But from a safety standpoint, from her endocrine system is concerned, this isn't putting her at risk anymore. And so, I'm like, okay, we'll just figure out the calorie thing later. Just feed less of it, let's cut that hay in half. And we'll have the structural carbs, the total structural carbs down. But you can see it's not bad at all. I didn't spend a lot of time on drugs. Drugs can be great. If you do there are some horses out there that, and we need the drugs in the PPID horses. We cannot get them fully managed. We can't get their pituitaries to stop making the wrong hormone without Percend. But the equine metabolic syndrome horses, there are a subset of them that you're going to get the diet and everything right, and their insulin is still going to stay high. And those are the ones that truly need the drugs. And then I never got to Thyro-L. So for horses that we recognize as equine metabolic horses that are obese, if we can get their lean body mass up and their fat down, we might be able to pull them out of insulin resistance. You'll still have to dietary manage them because they will immediately go back into insulin resistance if they get fat again, but we might be able to pull them out. And the reason we use Thyro-L is if we give them thyroid levothyroxine, we will increase their metabolism. And so we can take advantage of that. It'll increase for a short period of time. We can take advantage of that by increasing their metabolism, calorie restriction, exercise increase to increase their lean body mass, and we can get weight off these guys really fast. That is really what we should be doing with the levothyroxine. But once we get their body weight down, we shouldn't need it anymore. Yep. So, all right, so dietary management is key. Protein and fat, even if we get, it's not decreasing just calories in these guys. We need to make sure their fat intake and their protein intake matches what they need. And every horse is going to be a little bit different. High quality ingredients. There's another horse talk that I attended that showed the same dietary outlay of fat, carbohydrates, your macros, so to speak, for horses, of very poor ingredients versus very good quality ingredients. It's like me trying to balance your diet with cereal versus greens and salad bars and lean proteins and whatnot. And the difference, one horse on poor quality food but accurate nutrition from a paper standpoint, there's a picture of them, switching them, and about 90 to 120 days later, taking another picture of them being on high quality ingredients. The change in their body, their coat, their muscle mass, even though they're both getting adequate protein, this was a better source of protein versus this beef jerky or Slim Jims versus chicken, right? Which, right? It's still whatever many grams of protein, but we know the chicken's better for us than the Slim Jims for us. Same with horses. And so, if you buy the highest quality ingredient food you can afford is my recommendation there. Treats, yeah, so high sugar treats. I just discovered a treat. Don't feed, your endocrine horses should not have high sugar treats. And you're like, what about, I have my PPID horse, you're telling me I shouldn't give it high sugar treats. I need to pull up a different talk, but I just found, highly recommended in a veterinary forum I'm on, it's a light, L-I-T-E, horse treat that is malleable, that people swear for giving Percend in. Yeah. And they can buy it on Amazon. But somebody left because they were telling me some of the other things. How many of you give percent to horses? Yeah, and how many of you struggle with your horse eating it? Yeah, almost all of you. So those of you that don't struggle, do you have a horse that just takes it in their grain and they're like angels? Do y'all know how lucky you are? Yeah, because it tastes, according to horses, it's the worst thing you could ever put in front of their nose.
Why they can't?
They didn't do a taste test before they, and the FDA makes it next to impossible to change a formula once it's approved, so sorry.
Can you put sugar-free maple syrup?
So somebody was here, she had to go do night shift at the donkey place. Yeah, so she does something that I've recommended, and she says it works great. So I have a firsthand. You can buy on Amazon gelatin or vegetable caps, medical capsules, and it's a number 1 or number 2. I believe is what the percent fits into, and
About 500.
yeah, they come in a big, and they're like $6. Oh, really?
Then they find out what's the other go around it.
Yeah. And so the biggest secret is it dissolves gorgeously in water, and it dissolves like that in water. And so get a small volume syringe, a 3 ml syringe, and put 2 mLs of water in it and dissolve it in that and squirt it in their mouth. Yeah, and it's the best thing. It's easy because it's easy. It dissolves beautifully. It's a tiny volume. Yeah. So, but I'm happy to pull those treats. It's an LITE. I think it's A to Z light molasses treats. They're on Amazon. I have them in another talk. I didn't put them in this talk, so I can find it. Yeah. But they're really low and they're malleable, so that you can form them around.
For a couple of weeks.
Yeah, there you go.
Can you use sugar-free maple syrup?
Yeah, you can use anything sugar-free. So I know people that have a drill that they get the big, huge bags of carrots, and they'll cut the carrots into chunks, and sitting down at the TV, they'll go through all of their carrots and use it and bore a hole, a hole halfway through the carrot, and then they'll stop every day. They'll take one of those chunks and stuff and give it, for a while. Yeah. So I know everyone loads of tricks, but ultimately people start dissolving it, just squirting it. Big Newtons, but they're high in sugar. Yeah.
A to Z horse cookies.
There you go. Light version. There you go. Yep. And that is a second-hand referral for that. Yeah. Mm-hmm. Yeah. They're very low sugar. But there was a veterinary forum I was on that people were complaining about percent. And that product came up numerous times. So, yeah. Oh yeah, you didn't interrupt me. Drawings. Quiz. Oh, a quiz.
Yeah.
Oh, yeah. Do you have one?
Right. So who can tell me 3 symptoms of TBID?
She doesn't shed out.
Okay.
Pressing neck, that's pretty good.
Uh-huh.
Am I going to give all 3? I don't need that. I really don't. So, somebody else will take my 2 and add 1.
Okay, loss of muscle mass, being lethargic, not shedding.
Perfect. Yeah. No, mind blank.
Another question is, who can tell me what PPID stands for?
on the yeah, woohoo! Pituitary pars intermediate dysfunction. And what a website.
All right, last one for some pretty pink polo reps. Who can tell us the name of the website to learn more about PPID? Say it again.
Awesome. I don't know how they wanted to. Thank you.
some
raffles
stick
as
around
well.
for that, but thank you, Dr.
Yeah.
Settlage, so much.
Y'all been very patient. I went way over. Thank you.
And we'll be sticking around, so
Yeah.
if anybody has questions, feel free to come up to us afterwards, and we're happy to talk to you more.